Today we will be demonstrating the proper sequence for donning or putting on and doffing or taking off of personal protective equipment or PPE. The same sequence that we use for the Ebola PPE can be used for standard precautions, just using the specific identified PPE for those guidelines. I will be acting as the trained observer, assisting Lydia in the proper sequence of donning and doffing. I'd like to start by just showing you that we have packets of PPE prepared for you and available in your departments. There are two separate packets. This one is labeled Ebola Caregiver PPE, and it has everything you need to be protected from Ebola. The second packet is called the Ebola Trained Observer PPE, and there is quite a bit less PPE in here. The trained observer will be wearing this while they observe the employee putting on their PPE and taking it off. I think the best way to go about this is to open your Caregiver PPE and set it all out for yourself in order of how you're going to be using it. We'll be using our checklist. PPE items that you're going to be using for Ebola protection for the caregiver are assembled here on the counter for you, and I'll just identify them for you. The exam gloves are referred to as the inner gloves, and these are in order of how you're going to put them on. These are the waterproof booties. They go up to your knee. This is what we refer to as the paper bootie, which is going to go on over your waterproof bootie. Your gown that is impermeable to fluid. This is a chemo gown. Your N95 respirator. Your head cover. I can tell you that this item will be replaced when a different type is available to us with a collar, but this is the best protection we have at this time. Your outer gloves, which have an extended length cuff, so they go up to about here. And your face shield, which will be worn like this. You also have hand sanitizer and a roll of tape. The tape is for securing the gown as tight as you can around your neck. Some of them have a rather large opening. That the trained observer will be using will be a yellow isolation gown, as we're used to it being called, a pair of inner and outer gloves, and a face shield. Also, the paper bootie covers that go to the cap. Just a few principles to cover and the whole idea behind having a trained observer. One is that we are ideally trying to achieve no exposed skin. At this point, we're going to have just a little bit of neck skin exposed because we don't have the type of head cover with collar that we would prefer. It is on back order. Secondly, every step of the PPE donning and doffing has to be observed by a trained observer to be sure that each step has been completed as outlined on our checklist. The donning process is conducted under the guidance and supervision of a trained observer who confirms visually that all PPE is serviceable and has been donned successfully. The trained observer uses a written checklist to confirm each step in donning PPE and can assist with ensuring and verifying the integrity of the ensemble. No exposed skin or hair of the healthcare worker should be visible at the conclusion of the donning process. The observer is also able to assist as necessary during the donning process. I think especially helpful might be in taping the neckline of the gown a little closer to the neck. I will be functioning as the trained observer during this exercise, so the first thing I'm going to do is put a pair of inner gloves or exam gloves on. The next step is to put the knee-high boot covers on. I will only be wearing one pair of them as the trained observer. The next step will be to put my gown on. I will be wearing the yellow isolation gown. And we're tying this on the side, so it's easier to untie when we're done. Then next I will put on the outer gloves. In the packets you'll notice that there are two sizes of gloves. One is like a medium inner glove and a large outer glove, or a large inner glove and an extra large outer glove. So just take a look at them and make sure you select the one that will work best for you. Make sure you've got your cuffs extended all the way up, that you've got your thumb engaged in the thumb hole in this style gown, and then I will be placing the face shield on. This is secured with Velcro straps in the back. And now I am ready to serve as a trained observer. Lydia will be putting on her PPE to serve as the caregiver. She changed into surgical scrubs because they were available to her. If they are not available to you, you're just going to wear whatever uniform you wore to work that day. So Lydia is beginning by performing hand hygiene with an alcohol-based hand rub. And you can remember that we do have one of those contained in the packet. As she puts her PPE on, we will both be inspecting it to be sure that it is in serviceable condition. So Lydia, you want to start by putting your inner gloves on. And as the individual puts the item on, you can check it off so that you stay in sequence and follow the correct order. And then you're going to put on your disposable booties. These have a tape on them so that you can secure them. And then she will put the paper surgical booties over. All right, Lydia, your next step will be to put on your gown. And this is where I might want to help her. These gowns have cuffs. In the future, we may have gowns that have thumb holes. If there's a thumb hole, you're just going to insert your thumb through it. If you turn, Lydia, you can see that this secures with a Velcro tab back here. So just if you can pull it as tight as possible, you may not need the tape. And that actually looks like it's pretty tight around her neck. I don't think she would like it any tighter. I'm just making sure she's overlapped nicely and covered. Tie that on your side. She's tying in the back. All right. Lydia, your next step then will be to put on your N95 respirator. And at all times, I'm watching to make sure that she's doing this properly. She needs to secure the metal stay around her nose. She needs to do a test by inhaling to make sure that it sucks in a little bit. And next we'll put your surgical head cover on. Now if her hair was longer, we'd ask her to put it in a ponytail so we could get it up under the head cover. It crosses in the front and it's going to tie in the back. So she's actually going to get pretty good coverage of her skin with this method. She's having a little trouble in the back here, so I'm going to help her, and I can pull this down, making sure. I think I'm actually going to even tuck that in your gown. And then I'm going to secure it with a bow so we can get it undone later. All right, I'm just going to have got a little gap right here. I think I'm going to have you turn around again, Lydia, and I am actually going to tighten this up a little bit more and use our tape. Make sure you have a nice long enough piece so that it stays secured. Okay, that looks good. And then your next step is going to be put on your outer gloves. I'm watching to make sure she's got them fully unrolled and nice and tight up here. You may have seen in some videos them applying duct tape up here. We are not using the duct tape because we feel that it creates a bit of a hazard when you try to remove it. Right, Lydia. And now your face mask is the final piece. Okay, she's got, Lydia, before you put that on, I'm just going to have you tuck your bangs under your hat a little bit more before I can do it for you. Okay. Now I'm going to take a look around. I'm going to tie her up a little bit tighter back here to be sure she's got full coverage. You comfortable, Lydia? All right, I don't see any breaks in the integrity. The last step is going to be for her to wash her gloved hands and then let them dry before taking contact. And after I do a final inspection, I'll say, Lydia, thumbs up, yep, you're ready to go into the room. This is indicating to me that she's ready to come out of the room. Depending on where you're at, it may mean a phone call, it may mean a light, it may mean a call bell. However, somehow you should indicate that the person's ready to come out. The purpose of this step now is to prepare for removal of the PPE. And before entering the PPE removal area, she is going to inspect and disinfect any visible contamination that's on her. And as a final step, she'll wash her gloved hands before she comes out. She will make sure that the trained observer is ready for her as she exits. Come on out, Lydia. Lydia, did you wash your hands? And I want to be sure that you turn around. I want to make sure you don't have any contamination on you that needs to be wiped off. And she looks clean. So you may exit and enter the doffing area. I will be reading aloud each step as she performs it and assisting as necessary. If I need to touch any part of her, I will have to disinfect my hands as well. That's it here for now. So, disinfect the outer gloves, and I assist with this part. Okay, Lydia, you may sit down then and remove your paper surgical bootie. She's going to be careful not to touch anything. She's really just dropping it in there. And disinfect hands. She can now remove her outer gloves. We're going to inspect and disinfect her inner gloves, and they look clean. Lydia's gloves were clean, so we just disinfected them. If they were dirty or torn, we would disinfect the glove, have her remove them, disinfect her hands, and we would put a clean pair of gloves on. So at this point we can continue, and we're going to continue by having her remove her face shield. Tilt the head slightly forward, grab the rear strap and pull it over your head. Let it fall forward into the receptacle. That's fine. You'll disinfect her inner gloves. She will now unfasten and remove her head cover. She may need assistance with this because it's tied in the back. We'll let her try first. You pull that one right there with your left hand. And we will disinfect her inner gloves again. She can now remove her gown and discard it. Please observe the steps in removing the gown. I will begin by helping her untie it. And I will remove the tape for you, Lydia, because I think that's going to be difficult. This tape can be torn pretty easily. Okay? At this point, I need to disinfect my hands also because I touched her. She's turning it inside out to keep the dirty side of the gown in. And she can now disinfect and change the inner glove. Since her glove kind of came off with her gown, we'll disinfect this one. Yeah. Oh, we can't. You're right, we can't. We'll just have to remove that. And we will disinfect her hands. She will at this time don a new pair of exam gloves. And she's going to be removing her respirator again in a similar fashion to how she removed her head cover by tipping her head slightly forward, grasping first the bottom tie and then the top tie. And we will disinfect her inner gloves. If in doubt, disinfect. At this point, she's going to sit down and remove her waterproof shoe covers. And we are going to take an extra step and disinfect the bottom of her shoes because she is going to walk out of here with these shoes on. Perform a final disinfection of her hands. So you can remove her gloves then. So she stepped off our defined doffing area onto like what we would consider more of a clean surface. And she will perform a final hand hygiene. I'm going to do a final inspection of her, looking at her very closely to be sure there were no breaks in her PPE so that her clothing underneath became contaminated. And everything looks good, Lydia. She can now leave the doffing area in whatever uniform she wore here today or her scrubs and her shoes that have been cleaned. And what is recommended is that the healthcare worker take a shower at this time. If you are one of the identified caregivers from our Ebola Action Team who will be caring for a patient who we need to keep in our hospital for 24 to 48 hours, we would ask that you bring a pair of shoes to work that would be dedicated for caregiving, which will be disposed of at the end of the patient's admission. If you have clothing, if you're in a clinic setting where you might have to wear the clothes you wore to work that day and the shoes you wore to work that day, those things would be left behind. You will be reimbursed for anything that we need to throw away. But that ended up being the easiest way for us to address apparel that you've got on at the time an Ebola patient presents. That concludes our demonstration of donning and doffing of Ebola PPE. Thank you for your attention.